Hello students, I'm Dr. Satish Mandli and I will be dealing with the topic on non-linear pharmacokinetics. This unit is divided into the different parts. This part will be the first one where we will understand about the non-linear pharmacokinetics fundamentals, its introduction, the difference between linear pharmacokinetics and non-linear pharmacokinetics, the different tests by which one can detect the non-linearity. So outline of this presentation is at the end of this part you will be able to understand what exactly is non-linear pharmacokinetics, how it is known by the different names. You will understand the differences between linear as well as non-linear pharmacokinetics, and you will be able to detect non-linearity using different tests. So let's move ahead. So before we jump to the non-linear pharmacokinetics, you all are aware about linear pharmacokinetics. So what exactly happens in the linear pharmacokinetics? Majority process that happens in a body, that ADME, that follows linear pharmacokinetics. So what does it mean exactly? That ADME is proportional to its dose, whether the administered dose is single dose or the multiple doses. So in such situation, the rate processes which happens in ADME that follows first order kinetics, and therefore it is known as linear kinetics. The important pharmacokinetic parameters, namely bioavailability, absorption rate constant, elimination rate constant, volume of distribution, clearance, these all remain unaffected, means constant, by the dose. So this linear pharmacokinetics is dose independent pharmacokinetics. These linear models assume that PK parameters for a drug will not change when the different doses or the multiple doses of drug were given. So this is all about the linear pharmacokinetics. Now what exactly happening in non-linear pharmacokinetics? Let's understand. It's totally opposite to the linear pharmacokinetics. The non-linear pharmacokinetics occurs when all these previously understood PK parameters like bioavailability, clearance, half-life, volume distribution, rate constants, they change with the dose. So therefore we also call non-linear pharmacokinetics is a dose-dependent pharmacokinetics, meaning that the drug concentration do not increase proportionally with the dose. This non-proportionality arises because of one or more processes that happens in ADME that becomes saturated. Now why this becomes saturated? The many processes that happens in ADME are capacity limited processes, means active transports that happens, and that active transport may happens because of say certain enzymes, certain cofactors, certain receptors, and so on. And being these finite numbers, they easily undergo saturated when the concentration of drug is increases. So at higher doses, such processes become saturated. So in such cases, that first order kinetics which happens in linear pharmacokinetics that transform into the mixture of first and zero order kinetics. So sometimes non-linear pharmacokinetics is also known as mixed order kinetics, because initially you will observe the first order, in the latter stage you will observe the zero order. So the mixture of this become a mixed order kinetics. So what are the clinical implications of non-linear pharmacokinetics? The small dose changes that can cause the large changes in the drug concentration, and that leads to increase the risk of toxicity to the therapeutic failure. So what we understood from the non-linear pharmacokinetics, that all the carriers, enzymes which have the finite numbers, the finite capacities, and they are susceptible to the saturation at higher drug concentration. So whenever the particular drug's concentration become higher, that processes which are actively involved with the help of carriers and enzymes, those become saturated. and that leads to first order kinetics converts into the mixed order kinetics, and that PK parameters change with the size of the dose administered. So this is the reason why it is known as dose dependent pharmacokinetics. So non-linear pharmacokinetics is known by different nomenclature like dose dependent pharmacokinetics, mixed order pharmacokinetics, saturation pharmacokinetics, as well as capacity limited pharmacokinetics. So let's understand the differences between linear as well as non-linear pharmacokinetics. So what is the dose concentration relationship in non-linear pharmacokinetics? It's non-proportional. Means it increases in the dose lead to more or less proportional increase in the concentration as well as AUC. Pharmacokinetics parameters. Those are constant in linear, which are become variable in non-linear. So PK parameters changes with the dose and the concentration in non-linear pharmacokinetics. The kinetics order that follows in linear pharmacokinetics is first order, that is all the rate processes are proportional to the concentration. Whereas in non-linear pharmacokinetics, it often exhibits mixture of first order, zero order or zero order. That means here the kinetics involved is saturated kinetics. So sometimes it is known as Michaelis-Menten kinetics. So saturation happens with the ADME at higher doses in non-linear pharmacokinetics. The area under the curve that increases disproportionately with the dose, so can be more or can be less than the proportional one. So variable AUC that happens in non-linear pharmacokinetics. The half-life changes with the dose often increases at higher doses due to the saturation. The predictability about this is very less. The variety of drugs that undergoes non-linear pharmacokinetics, the very common are phenytoin, alcohol, salicylates, theophylline. At the higher doses, where the active transports involved during ADME, that becomes saturated, and these drugs exhibits non-linearity. So clinical implications that we got to know for such drugs and in such non-linear pharmacokinetics requires individualized dosing, and we need to monitor to avoid toxicity or inefficacy. Moving to the next, how to detect non-linear pharmacokinetics, or simply test to detect non-linearity. There are different tests are there by which one can understand whether the non-linearity is exhibiting or not. So we will understand the 4 types of tests by which you can detect non-linearity. So the very first one is determination of steady state concentration at different doses. So the dose of the drug at a different doses is administered, and we need to measure the plasma concentration at steady state. So if that steady state concentration is directly proportional to the dose, there is a linear pharmacokinetics. But if that steady state concentration is disproportional, that means increase or decrease, then that shows non-linear pharmacokinetics. Another test is determination of important PK parameters. So after getting the data, estimate the different PK parameters at different dose levels, and if that PK parameters remain constants regardless of the dose, that shows linear pharmacokinetics. But if the variation in PK parameters observed with the dose, that shows linear pharmacokinetics. So disproportional steady state concentration, non-linearity. Variation in PK parameters, non-linearity. Other test by which one can detect the non-linearity is plotting the area under the curve versus dose. So what data we will get, plot the AUC and observe if the linear relationship between AUC and the dose observed, that indicates linear kinetics. If deviation happens, that means AUC may increase or decrease right? That disproportional, that indicates non-linear pharmacokinetics. So non-superimposable AUCs we can say here, which shows non-linearity. This other method is also there by which you can detect the non-linearity, that is known as Michaelis-Menten kinetics analysis. So fitting the concentration of time data to Michaelis-Menten equations can reveal the saturation kinetics. So these are the different methods are there by which you can detect the non-linearity. So what we learned in this part? So we understood the capacity limited process becomes saturated, which leads to non-linearity. So that capacity limited process may happen in absorption, distribution, metabolism and excretion. And that shows the non-linear pharmacokinetics. Non-linear pharmacokinetics is known by different names like dose-dependent pharmacokinetics, saturation kinetics, Michaelis-Menten kinetics, mixed order kinetics, and so on. We also got to know the distinguishing differences between linear and non-linear pharmacokinetics, and we understood the 4 different tests by which one can detect the non-linear pharmacokinetics, like steady state, PK parameters, AUC, Michaelis-Menten equations and their kinetics. So this is it in this part. Thank you very much.